Musical therapy for depression. So, what is it, and how does it work? In order to answer those questions, we first need to ask, what is depression? Depression is a highly prevalent mood disorder that is characterized by persistent low mood, diminished interest, and loss of pleasure. It is a common mental illness that affects more than 300 million people worldwide. Depression can lead to suicide, and it has been linked to approximately 800,000 cases per year. According to research, depression appears to be multifactorial and involves both genetic and environmental factors. Depression is diagnosed in one of two ways. The first is by the International Classification of Disease, and the second is by the Diagnostic and Statistical Manual of Mental Disorders. Diagnosis requires the presence of at least one core symptom for most of the day, almost every day for at least 2 weeks. The severity of depression is determined by the number and severity of the symptoms and the degree of functional impairment. So, what does music have to do with helping depression? Music therapy can be defined as the professional use of music and its elements as an intervention in medical, educational, and everyday environments with individuals, groups, families, or communities who seek to optimize their quality of life and improve their physical, social, communicative, emotional, intellectual, and spiritual health and well-being. Musical therapy can be delivered to groups or individually, and participants may drop into an open group or be assessed by the musical therapist before placement. Music therapy approaches across the world have emerged from diverse traditions such as behavioral, psychoanalytical, educational, or humanistic models of therapy. This kind of therapy has two methods. The first method is the active method, where participants use improvisation or immediate composition to participate in making music. The second method is the receptive method, where participants receive or listen to music. Music therapy aims to improve health via therapeutic change. So, why music? How does it help? Music is often used intentionally to regulate moods and emotions in daily life. It can motivate self-image and coping mechanisms around difficult states of feeling. Music therapists assist participants by using musical components to regulate existing emotions or influence positive mood shifts. The methods described can be shown to have an overall beneficial effect on those experiencing depression. You may be asking yourself, how do you know? A group of professors and psychologists assessed an original collection of data published by the Cochrane Library in 2008. They set out to answer two important questions that the original research had not sufficiently analyzed. 1. Is music therapy more effective than treatment as usual alone or psychologically? And 2. Is any form of music therapy better than another form of music therapy? The study included 421 participants of any age group and compared the effects of music therapy versus usual treatment. After an initial review of the data provided, it was found that in the original research, trials had not been reviewed worldwide, meaning that not enough people from diverse cultures and backgrounds had been a part of the study, making the results biased. Small sample sizes also made it difficult to properly determine whether or not the original study had any important outcomes. After the adjustments made by the new authors, they concluded that musical therapy, along with treatment as usual, can help people affected by depressive disorders by improving symptoms related to the condition. The functionality in the lives of those tested had significantly improved when musical therapy was used in tandem with regular treatment or the use of medication. They also found that one method of music therapy was no better than the other when it came to improvement in quality of life. While more research needs to be done on cost-effectiveness and satisfaction with treatment, as well as including larger sample sizes of both children and adolescents, we can clearly see how music therapy can have a positive impact on the lives of those dealing with depressive disorders. Thank you for watching, and for more information or to review the study yourself, the article can be found at the link below.